Welcome to the next segment in a series of conversations with Dr. Paul Harch, and we are honored and blessed to have Dr. Harch with us through this continuing series. In this conversation today, we are going to focus on Chapter 5 of Dr. Harch's book, The Oxygen Revolution, and this is specifically regarding birth injuries and cerebral palsy. So welcome, Dr. Harch.
Thank you.
I'd like to start with just reading a couple of excerpts from your book, and so what you're saying here essentially is that, in fact, a trip down the birth canal is probably the most high-risk journey any of us will ever take, and it's risky for the mother as well. So
yes.
So you refer to third world countries, and there's a clear indication in third world countries that that it basically tells us we have a long way to go to provide the most basic care for mothers and infants in those places, I imagine because of the mortality rate that you can see in third world countries
Yes.
regarding childbirth, and you get further into it. And so when it comes to cerebral palsy, some people may not be familiar or know someone that has that, but you give a nice description here of what that really entails for the individual, for the families. The child has enormous difficulties, includes drooling, inability to speak, very poor coordination, low muscle tone. They could not stand or walk in order to keep them upright. And I understand there's a sort of that spectrum, of little damage to a lot of damage. And
Yes.
And so I'm sure that people that have children dealing with that would really like to hear your opinion on what hyperbaric oxygen could possibly do to help them.
Sure. Well, it boils down to what we've talked about with other topics. And cerebral palsy, neurological diagnoses are descriptive. They usually are not based on the pathology in the brain or the cause or even the areas that are injured. It's on the expression of that. So if you have certain physical exam abnormalities, behavioral problems, etc., and you then fit into, oh, that's cerebral palsy, or this is autism, or whatever. But all of them, the expression of whatever the injury process was in the brain is the result of the combination of brain areas that in fact are involved and injured. And with cerebral palsy, it is, like we talked about before, a wound to the brain. And there's kind of two large groups. There are the premature babies that are born who the center of the brain is the last area to develop, and especially the vasculature there, it is very fragile. So when they're born prematurely, they are prone to spontaneous bleeding in that central area of the brain. Well, that's where the white matter, the connecting tracts in the brain are. And so they get damage to these connecting tracts, and they involve primarily the motor tracts. And so that's the definition of cerebral palsy, is a static motor deficit. Most of them, in fact, are stiff and have high tone, but it's a wound to the brain. And so it should respond to hyperbaric oxygen like all the other wounds that we treat, and in fact, it does. And we found this out in a very accidental and almost serendipitous way, that when we started this program to look at any and all brain-based neurological injuries in 1989 with hyperbaric oxygen, as we just got into it in early 1992 and had treated maybe a handful of cases, our director of research, Dr. Sheldon Gottlieb, who is professor of biology, University of South Alabama, in Mobile, Alabama, went to a support group meeting for cerebral palsy mothers, mothers of cerebral palsy children in Mobile, Alabama, and he stood up and said, "We have a treatment for your children." And the next day he called me up and said, you're going to be hearing from some mothers of children who have cerebral palsy to enter into our treatment program. And I looked at him like, "Are you kidding?" I go, "Shelley, what do you know about cerebral palsy?" He goes, "Nothing." Now, he's a PhD. And I said, "What do I know about cerebral palsy?" I said, "That was my senior case in my pediatric clerkship in medical school." But I said, "I essentially know nothing. And you told these mothers we could treat these children. We were just looking at divers and boxers and people with strokes and so on." And it hit me like a lightning bolt. I stopped and I said, "Wait a minute. How did we get onto this?" It was by being open-minded. And why is this different from any other wound in the brain? And it wasn't. And so I said, "Okay, fine." Well, this mother called, 4-year-old boy, precipitous labor. She didn't go into labor, and she was due, so they induced her. And the first dose did not work of the induction agent, Pitocin. So they doubled the dose, and she went from flaccid uterus, no contractions, to birth in 45 minutes. Firstborn baby. And I mean, this is, the birth process. The body goes through stages, and the woman, the birth canal has to adapt and dilate and so on. This is, forcing the tomato through the neck of the ketchup bottle, essentially. And this child was born jittery, low glucose level, clearly injured. And it turns out had a subarachnoid bleed, and then delayed developmental milestones, and finally got a diagnosis of CP, and was a little hypotonic child like Pinocchio, could just limp limbs, had to brace him to stand. And I put him through the scan, SPECT brain scan, single treatment, repeat scan, and we saw improvement on that second scan. And I was like, wow, we can improve this child. Well, by 80 treatments, this child was walking with fingertip support for balance. And of course, I was beside myself. Wow. We had taken this child to this level with just a simple oxygen pressure treatment. And it opened everything up. And I started calling people up saying, we can treat pediatric neurological diagnoses and birth injury. And now we're, of course, way down the road with that. And I would say that probably 85% of cerebral palsy children will respond to this therapy.
Mm-hmm. How many do you think get it?
I don't know, a fraction of 1%.
Yeah, it's tragic.
It's horrible because, I mean, this completely altered the trajectory of this child's life. And it has the potential to do so with countless children. Mm-hmm. And the data actually is there for treatment right at birth. There have been 31 studies done in China on this with birth injury.
Oh, goodness.
Yes. But they're criticized because they're not rigorous and they're not done, according to, but it's based on that whole principle of reperfusion injury. And of course, the other group, besides the preemies, are the children that are term and are born with a difficult birth, the trip down the birth canal again. Like that child, who then have, or an arrest, or the placenta abruptly separates, or mother is bleeding profusely and her blood pressure drops. All of these things get transmitted to the fetus, now the baby. Or things that happen in the neonatal period. Anything that's injuring the brain and primarily damages the motor tracts potentially falls into that CP category. But in fact, in many of the cases, it's a diffuse injury to the brain. So they also have problems with cognition and intellect and behavior and emotions and so on. So it's not just a motor. 25% of them have seizures.
Yeah, so again, back to that question, and I'm just curious, because it's so tragic. How many have you treated? Like, how often do you see someone come in?
Hundreds.
You've treated hundreds. So
yes.
So it's clearly works, but the vast majority are not getting it. And so these children.
No.
Yeah, and so that's incredibly tragic.
Yes, and it's another black eye on, medical research and the way the studies were done. And it goes back to another topic that we talked about, which is the lack of understanding of this therapy by the medical profession, and in particular the hyperbaric medicine field. what this therapy is doing, what does it comprise, and what we also talked about is, redefining it, a scientific definition that really describes it. And so the pivotal study after that child and a series of others, and I called my mentor, Dr. Richard Neubauer, and I said, we can treat children. We can treat birth injury. This just opens up. And I also said that these children are going to be the ones who help advance and bring this therapy to public awareness. And he kind of poo-pooed it a little bit, but he had forgotten 3 years before, he had invited a Dr. Machado from Brazil to come and talk at his conference in 1989, New Horizons in Hyperbaric Medicine. What did Dr. Machado report? 230 CP children he treated from 1983 to 1989 and reported these miraculous results. Improvement in these children, cessation of seizures, and used inadvertently the same dose that I was using and that Dr. Neubauer had used in adults and so on.
At what age is no longer effective to help someone with CP?
I don't know that there's an age limit.
Oh, so there's even...
I've treated CP kids, adults, into their 20s.
Yeah, and see benefit.
Yes, you can see benefit.
Yeah, oh, that's...
And so,
Sooner better?
Pardon me?
Sooner better, that rule is...
Oh, obviously, yes. Just like we talked about. The general rule in medicine, treat anything sooner. And the results are better. So, unfortunately, this finally culminated in, an experience with some Canadian mothers who had taken their children across the pond to England to have some hyperbaric therapy, and a pediatric physiatrist in Montreal who was following the children when these kids came back from England, and he saw this change in their spasticity and just global change in these children. Couldn't believe it, and so started a movement to do some studies up there. Well, they did a study, it was positive, and so the Canadian government got leveraged by the mothers who walked into Health Canada's offices with TV crews live and pointedly put the authorities on the hook and on TV about appropriating money to do a study. And the government relented and brought in an outside researcher that effectively was tasked with proving this didn't work. Government didn't want to pay for it. And so they constructed this study with an oxygen pressurized group similar to the dose we had used and a control group of pressurized air that was thought to be a innocuous control placebo. It was another dose of hyperbaric therapy, and lo and behold, the two groups had identical outcomes. And of course, the rest of the medical profession said, look, compared to a placebo, this hyperbaric oxygen didn't do anything. It's all placebo effect.
Must be psychological.
And that's what they attributed to. It was called the parent participation effect, where the parents kind of cheer-led those kids and went in the chamber with them, and it was an atmosphere of bon vivants, and the children got better. Well, the reality was they did half the kids in a multiplex chamber and half in a monoplace where the kids went in by themselves. So there was no parent participation effect.
Oh.
But the problem is, once in the medical literature, and it was in a very prominent journal, The Lancet, the American neurological community pediatric looked at it and said, see, we told you. You can't treat chronic brain injury, and look at this. And now additional studies have been done showing that, in fact, that was a therapeutic dose. And it's the same dose that was used as a control group in the Department of Defense TBI veteran studies, where we tried to tell them, didn't you learn anything from the CP studies? You are now applying a dose in these veterans that nobody's tested before.
That's interesting, and I think a lot of people have probably heard of the Lancet today.
Oh yes,
because of this Nobel Prize winning drug that they said was a horse medicine,
yes.
ivermectin, right?
Yes,
and so and then hydroxychloroquine. I think they said they didn't work, and they were all snake oil, and didn't have any impact. And of course, we're finding out that is an amazing amazing.
Yes.
I don't know if we call it a drug compound, of sorts that saved many, many lives with this whole COVID crisis.
Yes.
Yeah. So the Lancet. So you've experience with that. So I have a negative view of the Lancet, but I think they're trying to save face now, and they're telling the truth about what really went on. And
They did, but again, in fairness to the reviewers of the articles, they didn't understand hyperbaric oxygen therapy, and they are dependent on the domination of the United States medical society that oversees hyperbaric medicine, who has misdefined this therapy. And so there was no concept that elevation of pressure and oxygen in the control group was in fact bioactive and effective. It was looked at as a placebo. And so even amongst the authors, the primary author brought in by Health Canada to be the principal investigator, and the doctors, Dr. Pierre Mauroy and his group, who had been following the children, seeing them, and were responsible for doing the study, fighting with the editorial staff of The Lancet to tell them this is in fact, a therapy that got delivered to these children in the control group. And they got it changed from placebo to control group. But still, the final conclusions they cited as the parent participation, the actual conclusion says, well, we measured a very hard outcome, which was motor function, from which usually there was not any placebo effect in that. However, we believe there is a placebo effect, and they cite as a reference a book on pediatric development that has to do with personality. It's contradictory.
One of our goals at HBOT News Network is that we do the research rundown, and for me, it's looking at these conclusions, and I guess it's coming from the reviewers,
yes,
limited what they can say, and often very biased and misleading.
Very much so.
And so in hyperbaric oxygen, even in the so-called placebo effect here, where they're just pressurizing the air. So, from our previous conversations,
it's not a placebo.
Well, we understand you're getting oxygen into the plasma, right? Your hemoglobin
yes,
is somewhat saturated. You're getting it in the plasma, and you're starting this gene therapy. And
yes,
just something about the gene therapy is that I understand that there's a higher degree of stem cell production. So you accelerate some stem cell production. Is that an occurrence that occurs with that?
That is part of it. But the other component that everybody has left out is the barometric pressure component. So remember my interaction with the FDA and their first time look at hyperbaric medicine for my IDE application. And they said, well, it's the first time we've really looked at it on the drug side of the FDA. Doctor, you're putting people in a chamber and you're doing two things. You're turning up the pressure and you're turning up the oxygen. It turns out the pressure is independently bioactive. And there's an overlap between what the pressure and the oxygen do, and there's an interactive effect as well, where oxygen can shut down the expression caused by the pressure. So if you look, and I would go to the Team Luke 3 Hope for Minds website, nonprofit in Texas, started by the father of a child who was injured in a golf cart accident, severe traumatic brain injury. Poor child, he just died this last year after, I think, 4 or 5 years post-injury. But the point is, Dad puts on a medical conference every year about brain injury in children. And I give a lecture every year there. And last year's lecture, mine was on hyperbaric oxygen and stem cells. And what is on there is a summarization of all of the science showing that with a hyperbaric treatment, it affects every stage of the stem cell process. So it causes proliferation of our stem cells in our bone marrow, the release of them into our bloodstream, where they now mature to express receptors so they can implant into tissue, stimulates the implantation, stimulates the migration in the organ or tissue of injury, and finally the maturation of those stem cells to become the target organ tissue, neurons, for instance, or heart cells, or whatever. And we have a new finding now in over 20 of the children that I've been treating who, when they are in the midst of hyperbaric treatment and then have gone for stem cells, and in particular, this one doctor who is Dr. Profrock, who is harvesting adipose stem cells, so from a little fat pad in the children at the base of the spine, he has found now that the harvest of stem cells is over 4 times the amount that he typically gets in children who have not had hyperbaric oxygen. So what it is showing is systemically, at least in the fat cells, but knowing the way this works, systemically we are increasing stem cell production. And he is harvesting 4-fold, 300 to 400 million stem cells. And the activity of them is different, in that normally he stains them with a special stain to count them. And it kills the cell, but you can then count them. It's not killing the stem cells that the hyperbaric oxygen has stimulated. He said, I don't know what's going on here. These are very lively, healthy, the immune system and so on.
So the ones
and
that
then
he
he
harvests,
injects them, and we couple that with a hyperbaric treatment to facilitate implantation.
so the one he's harvesting from the fat,
Yes,
he stains them, they die.
correct.
The ones from that are created through the hyperbaric treatments, as you said, from the bone marrow.
Well, no, I confused it. What he's doing is, so he takes the sample and he takes a tiny aliquot of that to measure the numbers.
From the blood supply?
From the fat. So he extracts some fatty tissue, a syringe and needle, numbs it up, the syringe and needle, and then he processes them and gets a quantity of stem cells. He then takes a tiny sampling of it, puts it on a slide, and they have a counting apparatus where he can count those stem cells. Well, he stains those to count them. So those cells do die, but he can count them. The rest of them, though, is from the big aliquot. Those are active. Those are the ones he then injects.
Mm-hmm. So how does he know what's coming from hyperbarics and what's
Well, all of the children he has done before, the most they ever harvest, doing it the exact same way, is about 80 million.
Oh, what's interesting is that I'm aware of a patient, and he's 21 years old, and he was a quadriplegic, and so he did go to get the stem cell treatments, and they harvested him, and they were blown away by nearly triple the amount of stem cells that they were able to harvest, and that's Dr. Stevens in his practice of harvesting the stem cells, to do that from the fat, and then injecting it into various sites.
So to get back to your question, hyperbaric oxygen stem cells, it affects every single point in the pathway of stem cells, from bone marrow and even systemic production of stem cells.
So better quality,
to implantation and maturation.
Better quality, more robust, more.
Yes.
Through the whole process.
Yes.
Very interesting. Yeah. So for the cerebral palsy cases, in those cases, is that part of that process? Is the
Yes.
stem cells?
It's a part of the process for anyone going in a hyperbaric chamber. And what was now just presented in May, there's a doctor, Kent McLaughlin, up at University of Wisconsin, who had first done this with just normal baric administration, like I gave to little Eden Carlson, the little drowned girl whose article, is published. He did normal baric oxygen in animals and measured stem cell production with it. He now has taken humans and, with compressed air treatment, also measured increase in stem cell mobilization into the circulation. Mm-hmm. So he's now filling in some of the gaps on this lower pressure range, which has been so effective clinically, but almost completely uninvestigated, except for the doctors who did all the physiology experiments on barometric pressure. Barometric pressure and its activity is all done in that low pressure range. Well, I should say the whole spectrum of pressures, but there's a concentration of data in the low spectrum range.
So from the standpoint of the children in cerebral palsy,
yes,
what effort has been made, to really spread the word far and wide? Is it, and who's blocking it?
Just what we're doing, and this type of forum, and so on. Because
why are doctors not interested? Because
of that Lancet study. There was actually that, and then another one that was followed where the doctor made the same mistake. uh, and had a pressurized control group. The two groups did the same amount. The rate of improvement in them, though, was significant and greater than the rate of improvement you get with physical therapy or any other therapies. But they prematurely stopped the study because the control group was improving at the same rate that the hyperbaric oxygen group was. And it was, when it was published, in the same issue, the editors of the journal had an invited editorial by these two doctors from New Zealand and Australia. And it said, hyperbaric oxygen for cerebral palsy, the last breath. Meaning, the nail in the coffin. Here is now the study definitively proving this doesn't work. And again, they were wrong on the science. So the average medical doctor out there, the mom comes in and says, how about hyperbaric oxygen for my child who has CP? And if they don't know about the literature, they run into their computer and do a PubMed search, and they pull up the article and the abstract. So, randomized controlled trial by Dr. Dan Lacey, and no result. Negative result. It didn't show anything. Pull up the Lancet Collette study. It didn't show anything. And they walk out and they said, ma'am, the science is showing this doesn't work. And it doesn't matter how many letters to the editor were written by the doctors who are knowledgeable about this saying, wait a minute, you've made a gross error here. What gets presented there is the abstract of the main study.
Now you have these very educated people. They understand a lot more of what you're talking about than I do, and I understand it. Okay, so what doesn't make sense is that you have two situations here in a study, both get better.
Correct.
And we don't know that. I mean, we're educated. We know all of this stuff. How could we not know that? And so why are we not concluding we need to study this more? Because all researchers don't put themselves out of business. They always conclude we need more research. Why would they say we now know?
Because they look up, when you do a study, you have to do a literature search on what's been done before. And when they pull these studies up, it's published in the Lancet. It's published in these highly respected medical journals that supposedly the reviewers and the editors are at the pinnacle of the profession, and it's considered validated that way.
So these are the same medical professionals that prescribe a drug, and it says on the warnings, if you have these symptoms, call your doctor immediately. They call their doctor, and the doctor says, oh, well, that's one of the symptoms. Mm-hmm. Okay, so why am I calling you? Those are the same ones that say it's okay to do that. We know this is going to potentially, it's saying it's doing harm because it's a warning, right? And up into and including even death, right, on some of the warnings. And so it's just hard for me to fathom that a doctor or someone looking at this doesn't have ill intent, because it's so obvious that it's like anything hyperbaric, I believe, helps, period. We should all do a little bit, right? Or a lot, depending on what our situation is. So why would they say no? It's snake oil, like you'd learned in med school.
Because again, Ed, in fairness to those doctors who don't have that negative bias and intent, they're just looking at what's out there. And in the middle of a busy medical practice and so on, if they're going over there and they do their quick search and they pull up an article and read the abstract and it's negative, and as I've told you, what was I taught in medical school about hyperbaric medicine? And 75% of medical schools teach nothing about it. So there's this massive ignorance and misunderstanding about this. And it again goes back to the way the medical specialty of hyperbaric medicine has defined its therapy. And the only way to overcome that now is like this, and in open forums that get widely publicized, where you could even have a debate with the chief naysayers. We've tried to do this. In fact, Exceptional Parent Magazine tried to have a webinar. What we did, we finally had a webinar where I was to debate, and some other hyperbaric doctors who were to debate neurologists on this issue of hyperbaric oxygen CP. They couldn't get a pediatric neurologist to agree to do it. Not one. nationwide search. This is the
Pulling the kettle
editor of
black.
Exceptional Parent Magazine. That magazine is in every pediatric physician and pediatric neurologist waiting room. They couldn't get it. And finally, they got two people, a neuropsychologist and a pediatric critical care doctor. And the the neuropsychologist at the last minute, 30 minutes before, called up and said he had an emergency forensic case and couldn't participate. There is no such thing as an emergency forensic neuropsychology case. That's a reportable case. It was an excuse.
Didn't want to come.
He didn't want it, yes. Especially since he didn't know anything about it. And the other doctor, God bless him, he chose to challenge me on hyperbaric oxygen in traumatic brain injury. It wasn't pretty. I mean,
Well, let's make a recommendation to a parent that has
yes.
a child that's suffering from CP, or they themselves could be in their 20s and they've suffered from
Yes.
it. And so from what I'm hearing from what you're saying is that if your doctor is telling you, well, I would ask the doctor what they know about hyperbaric oxygen, not if it's good for you. That's the first place you go, because they'll maybe be honest and say they know nothing about it. If those reports come out, learn, and we talk about these reports in our research rundowns, is that read the report, and what you will find, and if you find that both groups got better, and then they're gonna say this is, psychological effect, the parent effect, or whatever, is recognize the fact that maybe you could get in a chamber and bring your parent with you or go with your child and have that same psychological effect. Wouldn't that be great? Mm-hmm. Okay, and maybe it's hyperbaric oxygen or just the pressure, but either way, what do you have to lose? You
It's
have a life of suffering versus try this.
Yes.
And I'll pull out a little Italian Irish here. Screw what the doctor says and what the report says and find out for yourself.
That's what the whole point of the book was and why it was written in chapter 12, roadblocks to the future. It is, you cannot trust the medical profession at the institutional level and even, sometimes that biased personal doctor to do what's right for you. You've got go out and find this therapy and get it for yourself. Now, there's a caveat to that. I mean, you want to try to do this responsibly and do it right because you can injure people with it. You can give too much. You can toxify people, just like any drug.
You can drown from drinking too much water.
Of course you can. Look at Tylenol, the #1 poisoning drug in the United States, over the counter.
Yeah.
So
responsible medical professionals
yes.
that have experience in this.
Yes.
That's the way to go. And so we appreciate you very much for and hopefully that sheds some light on anybody that's dealing with cerebral palsy or has a child that's suffering from that.
I hope so.
I think we can get to millions if people that have children with that have the opportunity to try the therapy, see the results, and then just reach out far and wide and spread the word. So thanks again, Dr. Harch.
My pleasure.